Artificial Intel Pros and Cons, a career guide navigated by Brian Ross and ChatGPT 29 to 9091 athletic trainers. AI. Statement: AI can support athletic trainers by helping track injury reports, monitor recovery progress, organize treatment notes, review performance data, and identify possible injury risk patterns. AI may assist with wearable devices, rehabilitation tracking, scheduling, electronic health records, sports analytics, movement analysis, and return-to-play documentation. AI does not replace clinical judgment, hands-on evaluation, emergency response, athlete communication, medical ethics, or responsibility for safe care decisions. This role may become more technology-supported as sports medicine uses more sensors, video analysis, telehealth tools, digital records, and data-driven injury prevention systems. Pros athletic trainers perform important healthcare work that supports athletes, patients, teams, schools, clinics, and active populations. This role can offer meaningful work in sports medicine, injury prevention, rehabilitation, emergency care, and performance support. The job builds transferable skills in healthcare, communication, anatomy, injury assessment, treatment planning, documentation, teamwork, and emergency response. Experience can lead to advancement in sports medicine, physical therapy support, strength and conditioning, clinical management, athletic administration, education, or specialized rehabilitation roles. Cons: the work can be physically and emotionally demanding. Athletic trainers may work long hours, evenings, weekends, travel schedules, practices, games, tournaments, and emergency situations. The role requires strong clinical accuracy because injury decisions can affect health, safety, performance, and long-term recovery. Athletic trainers must balance athlete goals, coach expectations, medical standards, school or team policies, and patient welfare. Bottom line: athletic trainers are a strong fit for people who are healthcare-minded, calm under pressure, active, detail-oriented, and comfortable working with athletes and teams. This is a strong career path for someone who wants sports medicine, injury care, emergency response, and direct support of physical performance and recovery. Athletic trainers. Career guide: a strong athletic trainer usually develops through athletic training education, clinical experience, anatomy and physiology study, emergency care training, rehabilitation practice, and certification. Successful athletic trainers are calm, observant, professional, compassionate, and able to communicate clearly with athletes, coaches, families, and healthcare providers. Experience in sports, healthcare, fitness, physical therapy settings, coaching, emergency response, or rehabilitation support can be helpful. SOC description: athletic trainers specialize in preventing, evaluating, treating, and rehabilitating injuries and medical conditions related to physical activity. They work with athletes, students, patients, teams, schools, clinics, and other active populations. Common duties: evaluate athletic injuries and medical concerns. Provide first aid, emergency care, and injury response. Develop injury prevention and rehabilitation programs. Tape, brace, stretch, or support athletes before activity. Monitor recovery, progress, and return-to-play readiness. Communicate with physicians, coaches, athletes, parents, and healthcare teams. Maintain treatment notes, injury reports, and medical records. Educate athletes on injury prevention, hydration, conditioning, and safe movement. Attend practices, games, events, or training sessions. Follow healthcare laws, safety procedures, and professional standards. Core skills: injury evaluation, emergency care, rehabilitation support, anatomy and physiology, sports medicine, communication, documentation, athlete support, clinical judgment, problem solving, calm under pressure, ethical healthcare practice. Qualifications: athletic trainers usually need a degree from an accredited athletic training program. Certification through the Board of Certification may be required or strongly preferred. State licensure or registration may be required depending on location. Employers may require CPR, first aid, emergency care training, clinical experience, background checks, and continuing education. Experience in sports, healthcare, rehabilitation, fitness, physical therapy, or emergency response can be helpful. Characteristic traits: calm, compassionate, responsible, observant, healthcare-minded, professional, detail-oriented, patient, athletic, ethical, reliable, team-focused. Resume template: your name, city, state, phone number, email address. Professional summary: healthcare-focused athletic training candidate with interest in sports medicine, injury prevention, emergency care, rehabilitation, and athlete support. Skilled in communication, documentation, injury assessment support, treatment planning, and working calmly in active or high-pressure environments. Core skills: athletic training support, injury prevention, emergency care, rehabilitation support, sports medicine, anatomy and physiology, treatment documentation, athlete communication, return to play support, CPR/first aid readiness, team collaboration, clinical professionalism, clinical/athletic training experience, role or rotation, name, school, clinic, team, or organization, city, state, dates, assisted with injury prevention, evaluation, treatment, or rehabilitation activities. Supported athletes, patients, coaches, or healthcare professionals. Maintain treatment notes, injury records, or clinical documentation. Prepared equipment, supplies, taping materials, or treatment areas. Followed safety procedures, healthcare standards, and supervisor instructions. Communicated professionally with athletes, staff, families, or care teams. Education: school name, degree in athletic training, exercise science, kinesiology, sports medicine, or related field, year training/certifications, box certification, state license, CPR, first aid, AED, emergency care, concussion training, sports safety, or rehabilitation training. Additional experience: sports participation, coaching, fitness training, physical therapy support, healthcare work, emergency response, recreation programs, or team management experience may be listed here. Cover letter template: dear hiring manager, I am applying for the athletic trainer position. I am interested in this role because it combines healthcare, sports medicine, injury prevention, rehabilitation, emergency response, and direct support for athletes and active individuals. I bring professionalism, attention to detail, communication skills, and respect for patient safety and medical standards. I understand that athletic trainers must evaluate injuries carefully, respond calmly to emergencies, document accurately, and work closely with athletes, coaches, families, and healthcare providers. I am prepared to support injury prevention, treatment, rehabilitation, return to play decisions, event coverage, and clinical documentation. I would appreciate the opportunity to contribute to your organization with compassion, responsibility, and a strong commitment to athlete health and safety. Thank you for your time and consideration. Sincerely, your name. Elevator pitch: I am interested in athletic trainer roles because I want to work in sports medicine and help athletes stay healthy, recover safely, and perform responsibly. I am calm under pressure, detail-oriented, and committed to patient safety. I would bring professionalism, communication, and strong clinical focus to injury prevention, emergency care, and rehabilitation support.